Thanks for joining me for our second episode of Noble Thoughts, sponsored by the All Indiana Podcast Network. Violence against women, it's a major public health problem and a violation of human rights. That's according to a 2024 report from the World Health Organization. Researchers say it causes serious health problems for women and their children. In this episode, Michael Volpe discusses corruption in the family court, and the Indiana Coalition Against Domestic Violence shares hope for survivors. So, Michael Volpe, thank you so much for joining us and sharing your noble thoughts about family court corruption. We know that this is something that is very near and dear to your heart. You've done a lot of research, a lot of investigations. Can you kind of tell us what you've uncovered about family court?
Yeah, so first of all, there's a lot of money that floats through it. I think the number was $50 billion per year, and that corrupts. I think that's the best way to describe it. And what's basically been created is a mess, a complicated mess that benefits the system where judges are allowed to run wild. They are also allowed to appoint as many people as they want. All of these people were appointed like a guardian ad litem, parenting coordinator, custody evaluator. There's an alphabet soup of court appointees. They get to charge the parents. I think the worst part is this is all coercive. It's not like you, the parent, go to buy a car and you are completely in control of what car you buy, when you buy it. The court says, here's a guardian ad litem. They're going to charge you $200 an hour and tough noogies if you can't afford it. And I've seen cases. One woman, Susan Skip out of Connecticut, was forced to liquidate her 401k. They will go to those kinds of extremes. They will threaten you with jail if you don't pay it. And none of it, it's governed, I guess is the best term, by in the best interest of the child, which is a very, let's say, vague and ubiquitous phrase, and almost none of it is actually in the best interest of the child. The idea is to run up billable hours for the lawyers, the court appointees, and for the lawyers and the court appointees to get as many other people appointed to run up billable hours. And at its worst, that's what it is. And it needs to change, because what you're doing is you're bankrupting people. You're taking people who were financially well off and making them poor, and you're taking people who were gainfully employed and making them unemployed. I wish I could figure out how to do a study on this, but I think the economic benefit of all of the people who have been destroyed, undestroying them and putting them back in the workforce, I think you'd see the GDP grow by a significant amount, our economy grow, everything. And so that's what I've seen with it.
And you have been doing this research for quite some time. You have a video up on YouTube about family court corruption. Can you tell us what the video shows about the guardian ad litems in St. Louis County?
So yeah, I got that from a deep background on the source. It's I think 38 is the number that they used. Corrupt guardian ad litem in St. Louis County, though I think they also work in other counties. And what they do is they talk about having ex parte meetings with judges very nonchalantly. We'll talk about things like that. But the meeting was started, and this is almost 4 years ago, as one of the parents, Abita Tolu, sued one of the guardian ad litem, Elaine Podlowski, and all of them were very concerned about it. And Elaine wanted to use like a forensic tech person, because at the same time, an emailed newsletter had come out, and they wanted to find out who was behind the newsletter. So she had a tech person that was very expensive. She said $400 an hour. So the others wanted to pay for it, but they wanted to hide that they were paying for it. So they're all talking about the best ways to hide all of these things. And they go on for about 45 minutes, and approximately 32 minutes in, Sarah Pleben, who was one of the guardian ad litem, one of the older ones, who was basically running it, she's certainly the one talking the most, said, this threatens, whatever this is, to take down the entire system. Judges are in on it, and I think she caught herself and realized she might be speaking out of turn, and then started joking about how, well, they say that it's cash for kids, but I don't see any of the money. And of course, if you look at the backgrounds of all of these people, they have these gaudy paintings and other things. They're all doing well. And that's what the video is. These corrupt garden ad litem, they were secretly recorded. Now, got to be really foolish to have 38 people on a call and thinking no one's going to record you. Someone did, not my source, I believe. I don't think my source would have been invited, but I don't think I'll ever know who recorded it, but someone betrayed them and showed them in like their natural habitat, if you will, these corrupt people acting corrupt when they think no one's looking. And that's really what the video is.
How often, well, tell me this, what accountability measures exist, if any, for the guardian ad litems who abuse their power?
Well, so let's talk about in Missouri. In Missouri, there was recently a case where the the judiciary, the judges ruled that they have the same almost unlimited immunity. And in fact, the allegation in the case that they were overseeing, that they were making an order on, the allegation was that a guardian ad litem had committed perjury, and as a result of the perjury, custody was switched in a way that wouldn't have been switched without perjury. And the court said, no, the guardian ad litem, they are immune from from a lawsuit, even in the case of perjury. And of course, perjury could be pursued criminally. Um, and it depends on the state. There is a bit of oversight, but there's very little oversight. Ultimately, the oversight comes from the judge, who is the one appointing them. In essence, they can run wild. They're depending on the state, there may be a law that limits the amount that they can charge, maybe limits the amount of cases they can have at any one time. Uh, some of them are licensed or something to that effect, and you could try to go after them that way. There are like approved lists, and maybe if one is completely out of control, they'd be removed from the list, but very little oversight, very little.
Do you find that the court sides with the wealthier parent more?
Yes, though there it can be flipped. I've also covered it where what they do is exploit the wealthier parent. One example is David Segui, the former baseball player. They knew how much money he had and made him pay for everything. Gabe Shapiro, who he and his family started JPay, same kind of a thing. But yes, for the most part, they will side with the wealthier parent because the wealthier parent is the one paying for everything, and they're the ones who are going to get a bunch of lawyers. Those lawyers will come in aggressively more times than not. Though I've also seen the wealthier parent get exploited based on their wealth.
I know that you went into journalism after your own battle in the family court system. Do you see that journalists face any kind of blowbacks from having conversations such as this?
I didn't go into journalism after. My own custody case is relatively recent. It was in 2022, 2023. But do I see I I guess, yeah, maybe. One of the first stories I tried to do about a guy named Chris Mackney, and I wanted to do it because he had recently committed suicide. I had pitched it to this website. My editor had approved it. We wrote it up. We had a story done, and the head of the website said, not only are we denying this, but don't ever bring us anything like this again. I think this is changing, but the media treats this as a private matter, your custody case, your divorce, and also he said, she said, we don't want to get involved because one side is saying this, the other side is saying that, and it's not our job to figure out. Now, court is not a private matter. Yes, your children in one sense is a private matter, your divorce in one sense, but when it gets to court, that's not a private matter. It is a matter of public interest, how judges decide custody, how judges decide child support, how long these things takes, whether a judge is biased towards a man, whether a judge is biased towards a woman. Those are not private matters. those are matters of public interest. But I think the media doesn't view it that way. The media has been trained, and I believe by the judiciary, to view this as like it's a private matter. It's he said, she said. You don't want to, there's so many stories to cover. Just ignore these. These are not the ones you want to cover.
Anything else you'd like to say, Michael Volpe?
I think that the the reforms are not necessary. They're not that simple, but they're not that hard. What's hard is getting the will of the people to see that reform is necessary. And the blowback is huge from the system, from the lawyers, the judges, the guardian ad litem, and the therapists. And what you need is for the people who aren't going through this to see that it's a problem, to push the legislature along with the people who are going through this. The people who are going through this are putting pressure on the legislature, but they're a relatively small amount of people. What you need is for the masses to see it. And that's what we're doing here helps that. And it's, we're one brick in the wall, but you got to have a lot of media coverage of this and a lot more than has happened. But I also believe over the last, let's say, 5 years, the coverage in the media of this has exploded exponentially, and I think it'll continue. So I do see reform coming. It's already coming, and over the next few years, I think it'll come even more.
There was something that you said last time that we spoke that was very impactful to me. You said that people are starting to find out. They're noticing their friends and their relatives, and they are starting to notice that there's corruption within the family court system.
Yes, and I think primarily because there's no longer the stigma. If you're in a nasty divorce, it used to be you don't want to tell people because it's a shame on you. And I think people are realizing it's not you that's doing this. It may not even be your ex. The system is causing it. So more and more people are speaking out. And yes, and they're speaking out to more and more people. So that's how the general public is hearing about this, because your cousin, your colleague, your friend, your sibling, someone else is going through this, and they are now telling everyone. Whereas 10 years ago, you didn't want to tell anyone because you felt like this put shame on you. I think instead of the shame being on the people going through it, the shame is where it's supposed to be, on the judges, the lawyers, the therapists, and the guardian ad litem. And that's why I think the things are changing.
Michael Volpe, thank you so much for sharing your noble thoughts.
Thank you for having me.
We built this show to support sponsors. If you'd like to advertise on this podcast, please contact me on social media at BNobleTV. We're actually going to start with the evaluation director, Ms. Colleen. I want you to talk to us a little bit more about what you're seeing and the data that you're seeing that's coming in.
Yeah, well, at the coalition, we center listening. We want to really understand what's happening in our communities and what's happening with survivors in order to build programs that are really responsive to their needs. So thinking about what survivors are experiencing helps us know how we can best reach and serve them, because we just believe every victim of domestic violence deserves really supportive response. So we listen to understand what's happening with survivors so we can meet their needs, but also we're listening to understand what's going on in our communities so that we can invest in programming, resources, and training to really reduce the prevalence of violence. We know from the data nationally, but also from all of our own listening and interviewing with survivors, that where families' basic needs are met, the likelihood of violence is greatly reduced. So those are some of the things that we're doing, both listening to survivors to understand their needs so we can meet them where they are and support their safety, and also working to promote safe communities where the prevalence of violence, domestic violence, child abuse, all the forms is really reduced.
I know you guys have seen more than 50,000 people needing services within the last year. And some of those cases turned deadly. And Karen, you combed through those numbers. Can you tell us a little bit about what you're seeing?
Unfortunately, we know that while domestic violence related homicide especially is an outlier, it's the worst case scenario, and it's not the common outcome. But what we want to do is learn from those situations that do turn deadly. So we look at the numbers across the board, first of all, to identify those cases that are related to domestic violence so that we know that they've happened, so that we can learn from them to try to prevent that type of homicide in the future. We know that during during the pandemic and the lockdown that came with it, we saw a massive spike in homicide numbers, not just here in Indiana, but across the country. That bore out in the national numbers as well. And unfortunately, what we haven't seen is the corresponding fall after the fact. Some jurisdictions, some areas have seen a fall, and we did see a fall off initially when kind of, things went quote unquote back to normal. But our numbers have remained higher than they were prior to the pandemic and prior to the lockdown. Not to the levels that we saw during the pandemic, but certainly much higher than where we were on that kind of spectrum beforehand. So what we try to do is identify those cases so that we can acknowledge that that is the root cause and understand what happened there so that we can try to find a way to prevent it in the future. We can make sure that we're identifying those cases that are high risk for homicide. We can make sure that those survivors are receiving the absolute best supportive services that they can. We can make sure that the officers, the prosecutors that are responding in the criminal justice system, if that's the route that is gone, that they have the best training, they have the best way to work with that survivor to seek justice. But also that person who caused harm receives the intervention services that they need to change their behavior so that it doesn't escalate to a fatality.
I see in your numbers from just last year, 83 deaths resulting from 61 incidents. Can we talk about some of those markers or some of those things that you may see in a relationship that could be warning signs?
Certainly. So when we look across the board, there are certain red flags that we look for, certain indicators that this is a very highly dangerous situation. First and foremost is a history of non-fatal strangulation. If there has been one single incident of non-fatal strangulation, then the likelihood that that survivor is going to be either killed or at least potentially killed by their partner goes up about 750%. It's the number one indicator. So that is an issue, that is a type of assault that we have to take very, very seriously from A to Z all the way across the board in terms of an intervention. The other one is presence of firearm in the home. We know that the presence of a firearm in the home is a very high indicator of a lethal risk, potentially and most likely because you can't take that bullet back. Once you fire that bullet, you can't put it back in the gun. It's one of the forms of violence that is often deadly without being intentionally deadly. Very often firearms are brandished as a form of coercive control, but the gun goes off and you can't pull that bullet back as soon as it leaves the gun. So firearms in a home are another very large indicator that we look at in terms of domestic violence fatality escalating very quickly.
And I know Senator Kodora had been working on a bill to require those charged with domestic violence related crimes to wear a monitor if they're released. And you guys are doing so much to help survivors. Knowing all of this information, you've created many programs here. Maggie, can you talk to us about some of the programs that you've created to help domestic violence victims?
Yeah, so we've got, a comprehensive list of programs and resources for survivors that reach throughout the state. It's not just here in Indianapolis. Thinking of one, we have the Satellite Attorney Project, which we just spoke about a few moments ago. And that reaches, again, across the state. We've got 50 attorneys in most counties that are working to help survivors at no cost to the survivor. So they can help with, any type of legal issue that the survivor needs help with, so divorce, protection orders, eviction help, custody things, they're ready to help. And yeah, we really enjoy working with them. And in fact, our team sent out a survey to those that received legal help from the satellite attorneys, and 100% said that these attorneys led to them feeling more safe and more secure in their situations.
One thing that I've realized is the need for housing, safe housing. Can you talk about what you're seeing when folks are asking for help?
Right. So, like I said, we have engaged in extensive listening with survivors to understand their priority needs for safety in their lives and in their communities. Number one answer was housing. Right, like if you have to separate from a relationship because it's unsafe, it's really hard to do that if you're not going to have a place to hang your hat, especially if you have children. So housing is the number one answer that survivors have given us. And I think what was surprising to me about that was I expected it in the urban areas for housing affordability and availability to be a concern, but it was across Indiana communities, even the rural communities, same struggle to recreate safe lives. It's real hard to do that if you're afraid you're going to be homeless. So number one concern. So ICADV developed a housing program to respond to that need. And we have a housing program coordinator who is brilliant and one of the kindest people I know. And she works with our member programs all over the state to help survivors identify, because it's a really hard system to navigate. So helping survivors identify points of entry into that system and opportunities to find affordable housing within their communities so they can rebuild safe lives. So that's what we try to do, is just really understand what are survivors' priority needs. We at the coalition, we have the luxury to be able to listen, to identify, and build new best practices, because our member programs on the ground, they're responding to crises 24 hours a day, providing emergency safety sheltering, answering the phone lines. They don't really have the capacity that we do to listen, to look around, and build better. So that's what we do, is we get to listen to survivors, identify their priority needs, think about how can we best meet those needs across our programs and across our state, and then we support our member programs in doing that, in building better to reach more survivors on their own terms and to foster their safety. We want to be as accessible, as supportive as we can be, because the number two answer survivors gave us when they talked about the struggles in rebuilding safe lives was the amount of judgment that they face from all sectors related to their decisions. They said they face it from friends, from family, from the workplace, but also from service providers. So they said, if you want us to be able to reach out for support to change our lives, make it easier. Make it easier. We need back end support and resources, but we need front end feeling that we'll be believed and cared about.
What do you guys have to say to people who are listening that may feel hopeless?
The hope is there. The hope is there, the safety is there, the support is there. And we try to make it, and by we, kind of the advocacy community in general, we try to make it as accessible as possible, but keep reaching out, keep talking to us about the things that you need. But also, I think part of it is also, don't be afraid to tell other people what you need. There are a lot of family members, a lot of friends, a lot of folks who will look to the individuals who they know, and they will identify this, they will see this, they will, suspect that this is what is going on. But for various reasons, they may not want to reach out. They may not want to say something. They may feel like they don't know how to help, and so they won't ask the question. But for survivors, a big part of the challenge and one of the biggest barriers is the shame that has been put upon them. I don't say that they feel, because that shame doesn't come necessarily from them. It's given to them as a part of the coercive violence, as a part of what they see coming back at them. And reaching out to those folks who are your safety, who are your support, and saying, this is what's going on, this is what I need. Even if it's just to say, this is what I need you not to judge me. I need you to believe that I'm doing the best that I can with what's in front of me. And for those family members and those friends, when that person comes to you, understand the gift that is. Because it takes so much courage to reach out when the devil on your shoulder is telling you nobody's going to believe you, nobody's going to care, nobody wants to help you, nothing can change. So when that person comes forward and says, this is what I'm dealing with, this is what I need from you, be there. Be that person who's going to say, if you just need me to listen, I will do that. Because isolation is one of the primary weapons that a partner causing harm uses against that survivor. So when they can break through that, it's a massive, massive step forward for most survivors.
And we want to emphasize that the first 24 hours after a survivor decides that they want to leave, that's the most dangerous time, right? So it's important for folks to get teamed up with advocates. In creating a plan, can you walk us through what folks need to do once they've made the decision that they want to get out?
Who wants to take that?
Well, I think I don't know, it's hard to average these things, but we hear that on average survivors talk to 9 people before they make that decision about it. And I think they are auditioning us to find out if I make this break, will there be the support that I need? Will my family stand by me? Will they assist me? Can I get safety? They're interviewing people, 9 people, service providers, loved ones, friends, family members, to find out if I do this hard thing, if I do this dangerous thing, if I do this scary thing, will people have my back? So a survivor who's at that juncture of making the decision to leave has done a whole lot of homework. And we can just support that homework by helping them with safety planning, helping them with the resources that they say that they need, but also just continuing to provide emotional support throughout that time because it hurts, because you really care for that person you're involved with. So I think recognizing, like Karen said, the isolation, so many survivors have told us that the most important thing that the people they care about can do for them is just to listen and affirm. Just to listen and affirm. And I think those of us who are surrounding a person who's being harmed that we love feel like we haven't done anything if we haven't swooped in with a cape and, moved them out or written them a check. But survivors are like, just affirming that you care about me is what matters most in those moments. So I think listening to survivors, believing them, supporting their decisions because it's complicated, just saying, I will be here for you when you need me. I will be here to listen. I can offer you rides to this thing or that thing. So just listening to survivors about their emotional needs and their logistical kind of support needs is what we need all of us to do if we want to make it easy.
How can we support you guys?
Yeah, so we do have a donation option on our website. So we, implore people to donate to help us, and that goes to directly helping survivors through our programs and our other initiatives. We also have an event coming up in August, so expect to hear more about that, but it's our annual Race Away from Domestic Violence. We do it every single year to raise awareness for the issue and to show support for our Hoosier survivors, to show up as a community and let them know that we believe them, we're here for them, we understand domestic violence and, how devastating it can be. So those are 2 options. We also ask that you volunteer or donate to local shelters and service providers. They're the ones that, are also directly helping survivors every single day, as Colleen was saying, 24 hours a day. And, they really need that support. So please, look into your local shelters and offer them some help too.
The Indiana Coalition Against Domestic Violence. Thank you guys so much for sharing with us your noble thoughts.
Thank you.
Thank you.
Thanks.
Thank you for joining us for this episode of Noble Thoughts. Remember, if you'd like to support this platform and allow people to share their stories to benefit our community, please contact me on social media. Be Noble TV.